how about if it's a stationary kind of thing, you know, a stationary bike, a treadmill? Is that as good?
This is as good. Anything, we are mechanical, okay? You know, we are born or we are made to move. So this sedentary lifestyle is contributing to a lot of disease, not just, you know, heart disease, cancer, diabetes, and all these things.
Wow, just in exercise.
Exercise helps you to eliminate toxins because it increases your circulation, you sweat, and then you will eliminate toxins. Exercise is key. The other big thing in modifying your risk is what you eat. We are what we eat. Some of the diets are disease producing. They clog up the arteries. They are inflammatory. A good example is an American diet. You have a hamburger, you have a French fries, and then you have a Coke.
A fizzy drink.
You have a Coke, and then you are driving when you are eating that.
Now it's time for those contributions I talked about, but to get them in, you have to call. The number to call is 0808-054-2233. That's 0808-054-2233. You can also tweet at CTV_Mary A while we continue our discussions about avoiding heart attack. Now, you spoke about smoking. But what if somebody isn't smoking? What about exhaust pipes? What about pollution in the atmosphere? Is that as bad?
Yes, pollution can also lead to inflammation. Remember, I say...
So inflammation is the key word
there.
there.
Is the key word, because when you have, you know, you are breathing polluted air and all that stuff, your body is reacting to that by generating what we call free radicals. Okay, free radicals will damage your cholesterol. LDL cholesterol, it becomes what we call oxidized, and the body now will recognize it as foreign and will mount an inflammatory response. Okay. So pollution will do that. When you also eat preservatives, you know, preserved food and all that stuff, they will lead to inflammation.
We're getting a call in. Let's just quickly get Samuel. Yes, let's talk to Samuel first. Hello, Samuel. Hello, Samuel. Are you on the line?
Hello?
Yeah. How are you doing? What's your question? Good afternoon.
All right. Please, I want a doctor to enlighten me a little bit about this high blood pressure.
Okay.
What is the normal rate of the pressure that can take somebody to go on a drug?
Okay, good.
And like me, I'm 140 over 90 at the age of 40.
Okay.
That permits me to go on drug.
Thank you so much.
Okay, very good question. A blood pressure of 140 over 90 is, you know, by definition, mild hypertension. And
he's 40 years old.
Yeah, 40 years old. The first treatment for that level of blood pressure is not medicine.
Okay.
It is lifestyle.
In other words,
what you
how
eat,
much he exercises.
So you have to avoid, you know, eating too much salt. First of all, you know, avoid salt. Not more than 3/4 of a teaspoon of salt in a day. Okay. You have to avoid sugary stuff. All these, you know, minerals, you know, they are not good for you. Okay. You have to eat plenty of vegetables because vegetables contain potassium and magnesium, and those tend to bring down blood pressure, while salt increases blood pressure.
Okay. So this lifestyle, is it likely to bring down his blood pressure?
Yes, it is. That is the first thing to do. Okay, you have to do that. You have to drink plenty of water. You have to eat plenty of vegetables. You have to also do regular exercise.
Does he have to be guided about his exercise now that you define this as mild hypertension?
The exercise here is not going to do intense exercise. The moderate exercise is good enough, and you have to be consistent and regular about it. And then also you have to look at your weight. Okay, if you are overweight and you try to correct your weight, those things can take care of that level of blood pressure. Okay. Now, if you have done all that, your physician should give you at least 3 to 6 months to correct all that. If you do all that, that can be all you need. But if it does not, then you might just need a little pill to, at that level, one pill can do it. But if your blood pressure is very high, one pill cannot do it. You may need combination therapy.
Okay, we have Cynthia calling. Hello, Cynthia.
Hello.
Yes, we can hear you. Go on.
I can hear you. Good afternoon.
Good afternoon.
Okay, Doc.
Yes.
Okay, occasionally, you want to take a deep breath. Occasionally, if I want to take a deep breath, I need to have this serious pain in my chest.
Okay, Cynthia.
I need to have a kind of serious pain in my chest, and I'll be afraid to continue the deep breath. Occasionally, it comes occasionally.
Okay. All right, we'll have the doctor respond to that.
So occasionally,
deep breath. And then she gets pain in her chest.
Okay, it all depends. For example, what's her age, what is her weight, and all the other stuff. So there are a lot of things that will go into the history before you start trying to.
But really, nobody should be having pain with a deep breath.
Yes. For example, if you have pneumonia, first of all, every chest pain is not heart. Okay, that's why the doctor needs to take a good history and physical exam and get some tests done. For example, pneumonia can give you chest pain with a deep breath. Okay. Now, if you have blood clot in your lungs, what we call pulmonary embolism,
that could give you pain too.
It can give you pain with that. If you have inflammation around your heart, with fluid around the heart, what we call pericarditis, it can also give you pain with a deep breath. Now, if you have a fractured rib, maybe you fell down and your rib is fractured, you take a deep breath, you also have pain.
But you know, all these things you've mentioned are quite serious.
Yeah.
So she should actually see a doctor.
Absolutely. So it's not enough. Somebody needs to take time, get a history, and put it together. So everything is not hard.
I'm a bit concerned about people who have had a heart attack already. They may be feeling a bit confused about what's my life going to be like post heart attack, and not know what to do. Can they just go on as normal? Can they get back to optimal level as before the heart attack, or do they need some counseling about what they need to do?
Absolutely. First of all, there are a couple of things that needs to be taken care of. After a heart attack, some people usually get depressed. Okay. So if you have depression and your doctor notices that you can be cancelled and sometimes you need some support and medication for that. Now, after a heart attack, also depending on how big the heart attack is, you need cardiac rehabilitation.
Okay, cardiac rehabilitation. We'll come back to that. Yes. Peter is on the line. Hello, Peter.
Hello, okay, my question is like, if someone is like 29 to 30 years and his blood level is like 123/70, is you all right, sir?
Okay, thank you very much.
Can you repeat the question?
If somebody is about 20 and his blood pressure is like 123 over, I don't remember, like over 70, is that okay?
Well, that's beautiful blood pressure. I mean, if you don't have any symptoms and that's fine. It's a good blood pressure to have.
Okay, so let's talk about the cardiac rehabilitation.
After a heart attack, it's good for somebody to enter the cardiac rehab program. We are trained physical therapists or physiotherapists will guide you and gradually increase your activity under supervision, checking your blood pressure, checking your pulse with exercise, low-level exercise gradually so that you can get back to normal strength. Also cardiac rehab, that's when they also emphasize smoking cessation if you're a smoker.
Okay. So low-level exercise. Yeah, because you see, they say that, I don't know, tell me if it's true, that if somebody has had a heart attack, the risk of having another one goes up.
Absolutely. The risk of having heart attack is even much higher if you had one. However, you can blunt that. You can modify that by changing
this cardiac rehab.
The cardiac rehab.
I think Yetunde is back on the line, so let's try it her one more time. Hello, Yetunde. Are you there? No, we're not getting that. Okay,
so basically, post-MI, after the heart attack, there are a couple of things. The cardiac rehab is one of it.
Okay.
Then you have to now be on cholesterol medicine.
Okay.
Okay, your physician will put you on that. You have to take aspirin unless you have allergy to aspirin or you have bleeding ulcer. And let me just say this.
You have 30 seconds.
Okay, somebody that has a heart attack, if you're having a heart attack and you are not allergic to aspirin, by taking one adult aspirin and chewing that, you decrease your death rate or mortality by 25%.
Thank you very much, Doctor, for coming to the show. That's a wonderful place to end it. Dr. Nwosu, consultant cardiologist. Thank you so much also for being there with us. So many calls, Cynthia, Samuel, Tunde, and I can't get all your names. Thank you so much for calling in and for listening on the program. Have a wonderful day. I am Mary Alale Yusuf.